Madam Chairperson, you may begin.
Good morning, everybody. It is my honor to chair this meeting. It's the launch of the MHPSS Directory of Services, the first major project of the technical working group. Thank you to everybody who's logged on. There's over 30 people who have. Our special guests this morning the Honorable Minister Terrance Deyalsingh. I think he will come in soon. And then the country representative of PAHO, Dr. Wheeler, and Dr. Othello, who's not only director of the mental health unit, but the MHPSS chair. What I suggest today is that we apply the KISS principle. Keep it short and simple. We'll all share, we'll all listen to each other, and we can talk after. The first person we would ask to speak, let me ask a housekeeping question. Is the minister here or is he still in his meeting? Does anybody know?
Yes, still in this meeting. Good morning, everyone. And here, we'll update as he joins us. We'll update. Thank you very much.
Okay, so we will proceed. The first person who is to speak is Dr. Wheeler, who is the representative of PAHO. Dr. Wheeler, over to you.
Thank you very much, Madam Chair. Madam Chair Lucretia Gabriel. Well, in advance of the Honorable Minister being with us, Dr. Hazel Othello, who is the Director of the Mental Health Unit, Dr. Wendy Jeremie, President of the Trinidad and Tobago Association of Psychologists, our very own Dr. Claudina Cayetano, the PAHO WHO Regional Mental Health Advisor, members of the Technical Working Group on Mental Health and Psychosocial Support, all the other distinguished guests, ladies and gentlemen, good morning, and of course, a very happy new year to all of you. I know all of us are looking forward in anticipation to 2021 being somewhat different from 2020, but we just need to hold our breaths and be patient for a little longer. So I beg your patience as we go through this difficult time of COVID-19. But to the matter on hand, the launch of the Directory of Services for Mental Health and Psychosocial Support for Trinidad and Tobago, I bring greetings to you, not just on my behalf, but those of Dr. Carissa Etienne, our PAHO WHO Director, and Dr. Tedros Ghebreyesus, our DG, both of whom I represent, for today's launch. These virtual launches have now become a natural and normal part of our lives. But this launch of the directory is one that has been very much anticipated, and it is a major achievement, and one which I hope will be replicated in other countries of the Caribbean and in PAHO in general. So we know that conflicts, epidemics, socio-environmental disasters, natural disasters, migration, they all cause serious psychological effects and social suffering in populations across the world. We are not unique in this part of the world, but the psychological and social effects of emergencies can be acute in the short term, but they can also deteriorate mental health in the long term, as well as, of course, our psychosocial well-being. And these effects can threaten peace, human rights, and development. We've already seen even economic development that we're expecting our gross domestic product across the Caribbean to plunge significantly. So there are many impacts as a result of any kind of disaster, emergency, or in this case, a pandemic. So in these situations, one of the priorities is to protect and improve the mental health and psychosocial well-being of populations. And to achieve this key objective, it is really necessary to undertake coordinated efforts among the people who provide this assistance, both governmental entities, non-governmental organizations, and of course, importantly, civil society groups who are involved in mental health and psychosocial support. That's why I'm so pleased today to see the launch of this Directory of Services. I would like to firstly congratulate the Ministry of Health and the Honorable Minister for the great work and the focus and the investment that he has made in mental health. Not every country sees the importance of doing that. And for one who worked many years in the field in WHO, I can really attest to this. The work of the Mental Health and Psychosocial Support Technical Working Group is a great demonstration of a multi-sectoral approach and coordination action that is really very critical in advancing health in general, but more so mental health in particular, which we know, of course, is part of the overall health of any human being. We are very familiar with WHO's often repeated, but still relevant definition of health, which is a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. So we all can appreciate that the COVID-19 pandemic has changed our lives considerably in many ways. As any emergency or any traumatic experience will do on a large scale. So it's brought many challenges to all sections of the population, whether you're a healthcare worker, a student, a teacher, a parent, people with disabilities, older adults. And it's really difficult to imagine who has not been affected in some way or another. Even in the area of domestic violence, we know that women and children are particularly affected during this time. So the mental health and well-being of whole societies have been severely impacted by the pandemic, as we all know. Fear, distress, financial insecurity. We know many people have lost their jobs or have reduced hours. All of these things that have occurred as a result of COVID-19. This fear and distress and insecurity, these things are not uncommon at a time like this, but they're also very widespread. But for some people, these reactions become prolonged, severe, and disabling, thereby leading to increases in mental, neurological, and substance abuse disorders in populations, as we've already seen in countries across our region. And in addition, the COVID-19 stresses can trigger or exacerbate pre-existing mental health conditions. Our PAHO Mental Health Action Plan 2015 to 2020 urges member states, among other measures, to ensure the provision of mental health services and psychosocial support in emergencies and disasters, and to promote intersectoral, very important, intersectoral initiatives for the promotion of mental health and the prevention of mental health disorders, with particular attention to the life cycle, as well as address issues of stigma and discrimination suffered by people with mental health disorders. However, the results of the WHO Rapid Assessment of Service Delivery for Mental, Neurological, and Substance Abuse Disorders during the pandemic has shown that countries in our region have been reporting actually a scale down or closure of their existing mental health services due to fear of contamination and disease spread. And this is not unusual or particular to mental health, but it's been affecting a range of other health services. But this can further deteriorate the mental health status of the populations in the region. And in many cases, most mental health needs remain unaddressed. The response is hampered by the lack of investment in mental health promotion and prevention and care even before the pandemic. So I know from what I've been reading that in some other countries, governments are turning to mental health increasingly to be used to address the issue of mental health support. So this is why I'm so pleased to see the high level of focus given to mental health here in Trinidad and Tobago. Very early in the pandemic, we became one of the few countries in the region to establish this working group as the intersectoral coordination mechanism. It's remained active, and we can see there's been successful, and now with the launch of the Directory of Services. In addition, we've seen Minister Deyalsingh making a push for community-based mental health services. And PAHO recently supported the development of the implementation plan and monitoring framework for the National Mental Health Policy 2019 to 2029, along with an estimated budget, because we know that costing activities is critical. So we can learn a lot from what has been happening in other countries on community-based mental health that have established these services for many years, and we can build on these successes and avoid some of the pitfalls. Although we know that every country is not the same, we know there's a lot of experience out there. But with the leadership that's being demonstrated by the minister at the executive level and Dr. Othello, who's here with us at the technical level, along with the commitment and work of the mental health team, the whole team at the Ministry of Health, regional health authorities, and community level, which is now coupled with the involvement and support of various stakeholders, that this will continue to be very important in making the difference in mental health care. So it is a widespread collaboration that leads to success. So let us continue to promote a mental health friendly society, which advocates for increased investment in health and social systems to improve care and services for people with mental health conditions, and increase the priority given to mental health in public health research, especially during this period after the pandemic. Mental health was my first love, my first work in PAHO, and although I am not working in this area specifically anymore, it continues to be something very close to my heart. So we in the Pan American Health Organization and World Health Organization, we remain committed to continued support to the government's efforts to increase investments in mental health in Trinidad and Tobago. So as I close, I want to say on behalf of PAHO and WHO, congratulations again on the launch of the directory. And I know it will make a difference to people seeking mental health and psychosocial support services, as they will now be able to find them all in one place. Thank you very much, and thank you for your time. Back over to you, Chair.
Dr. Wheeler, thank you very much for a comprehensive overlook at what is happening in mental health, and for your congratulations on our week. Minister Deyalsingh, welcome to the meeting. All the protocols have been observed, but thank you very much for being here. We're keeping it short and to the point so you can listen and share on what each person has to say. The next person to present is Dr. Othello, who's the Director of the Mental Health Unit and the MHPSS Chair. Dr. Othello, over to you.
Thank you, Dr. Lucy Gabriel, co-chair of the Mental Health and Psychosocial Support Technical Working Group and esteemed chair of today's virtual launch. Minister, the Honorable Terrance Deyalsingh, Minister of Health, Dr. Erica Wheeler, PAHO WHO Country Representative for Trinidad and Tobago and the Dutch Kingdom Islands, Drs. Claudina Cayetano and Caroline Malcolm of PAHO WHO and other PAHO WHO guests, Ms. Dolores Robinson, co-chair of the Mental Health and Psychosocial Support Technical Working Group, Ms. Maria O'Brien, Director of the Mindwise Project, other members of the Mental Health and Psychosocial Support Technical Working Group and Network, stakeholders, service providers, service users, press, and other distinguished guests. A very good morning to you all and a happy new year to you all. Mental health services are known to play an important role in the maintenance of emotional well-being and in the response to changing emotional states during and after any emergency situation that affects a population. Researchers have clearly documented that during any outbreak of an infectious disease, the population's psychological reactions play a critical role in shaping both the spread of the disease and the occurrence of emotional distress and social disorder during and after the outbreak. It is therefore critical that the response of health systems to such an outbreak includes a robust response to the population's changing psychological needs. Over the years, Trinidad and Tobago mental health services have mounted responses to various emergency situations. However, in 2020, the onset of the COVID-19 pandemic presented our nation with a mental health challenge on a scale that was never previously seen, and I dare say was unimagined. As you have already been informed, we are not unique in this regard, and the mental health impact of this pandemic has now been acknowledged as a global experience with considerable variability in national responses. Like many other countries, Trinidad and Tobago faced the challenge of deploying skills and resources towards treatment of infected persons and limiting the transmission of the COVID-19 virus, while facing the additional challenge of finding meaningful solutions to the socioeconomic and psychological outcomes of the strict enforcement of public health measures. In a laudable response, very early in the course of the pandemic, the Honorable Minister of Health and the Chief Medical Officer recognized that promotion of behavioral health and mental wellness would have to be an integral part of this nation's pandemic response. In that regard, I was approached, and the mental health unit at the Ministry of Health immediately began to liaise with mental health team leaders at the regional health authorities. And consequently, since March of 2020, mental health services have been accessible to persons who tested positive for the SARS-CoV-2 virus, as well as persons in isolation and quarantine and frontline workers. On March 27th, 2020, training in the provision of tele-mental health services was provided to mental health professionals employed by the regional health authorities. Implementation of this model of care, which was completely new to our public healthcare system, began shortly thereafter, even as the regional health authorities adapted their existing mental health services to meet changing needs and new realities. That was quickly followed by an aggressive Ministry of Health Public Education campaign, for which briefing notes published online by the United Nations created Interagency Standing Committee were invaluable resources. However, the rapidly increasing mental health needs of the wider population soon made it very clear that over time, our response thus far would not even approximate adequacy. It was then that through collaboration with our health partners at PAHO WHO, we were able to reach out to stakeholders and establish a Trinidad and Tobago mental health and psychosocial support technical working group. We abbreviate mental health and psychosocial support with the acronym MHPSS, and the technical working group is abbreviated to TWG. So this TWG was launched on May 5th, 2020, met virtually on a weekly basis during the months of May and June of 2020, and has thereafter continued with bi-weekly virtual meetings, which are ongoing. The MHPSS Technical Working Group has over the past months had some sterling achievements which are worth mentioning today. For example, we populated and continue to update the 4Ws tool, which is a working document used to identify and illustrate from our stakeholder network who is doing what, where, and when. We also delivered a PAHO hosted webinar series addressing relevant topics such as self-care for healthcare workers, supporting adolescents and youth during the COVID-19 pandemic, and working together to prevent suicide. Today, we celebrate our arrival at a critical stage of our national COVID-19 mental health response and our simultaneous achievement of a very important milestone in the delivery of mental health and psychosocial services in Trinidad and Tobago. We can now boast of having a single website, www.findcareTT.com, at which much needed information about mental health and psychosocial support services can be easily obtained by potential service users and other interested persons. This resource reflects an approach of cooperation between the public healthcare system, a diverse network of NGOs, and the many fee-for-service mental health providers that have provided much needed services free of charge during the pandemic. I wish to sincerely thank every organization that has, through this network, risen to the challenge of securing the behavioral health and mental wellness of the citizens of Trinidad and Tobago, as well as our migrant community. Your participation and your unwavering commitment, in my opinion, demonstrates true patriotism. While I do not wish to usurp the authority of the person charged with the responsibility for the vote of thanks, I must acknowledge and thank our representatives from the Pan American Health Organization, without whose technical support, which was unwavering and consistent, none of this would have been possible. As we celebrate today's launch, let us not lose sight of the fact that there is much more work to be done. However, through the foundation laid by the establishment of this technical working group, I am certain that Trinidad and Tobago is well poised to meet the current and future challenges presented by this pandemic, as well as those that would accompany future emergency situations. I thank you for your attention, and I look forward to continuing the work of this technical working group so that we can continue to provide the mental health and psychosocial support that our nation needs. Thank you for your attention.
Thank you, Dr. Othello, as usual, on point and well delivered. Minister Deyalsingh, we are very happy to have you. Thank you very much for making the time. I would hand over to you for your presentation. Thank you.
Thank you very much, Madam Chair. Am I being heard? Yes? Dr. Gabriel, you are the chair. Am I being heard?
Yes, you are.
Thank you very much.
Minister.
Great. So I stand on the protocols already established. I just want to say how happy I am to be here this morning. On becoming Minister of Health in 2015, I quickly identified two areas of the health landscape, and these are my words, that I saw as being treated by the Ministry of Health and by all decision makers as the ugly ducklings of health. Those two areas which I identified were, one, the provision of dental services, and 2, the provision of mental health services. It was my view that little or no attention was being paid to those 2 very important parts of the health landscape. So therefore, for me to be here today, 6 years later, at this virtual meeting on the mental health and psychosocial support directory launch, to me, is a red letter day for health in Trinidad and Tobago. And let me explain why. I always tell my team I am not a doctor, but I am a manager. And I always tell them, you learn in management school, you cannot manage what you cannot measure. And this directory is testimony to the fact that we are now in a position to measure. To measure objectively and statistically what is the true state of play as far as mental health is concerned. Because only when you know that as a manager can you allocate resources. So I want to congratulate everyone who has been involved in this project today. This mental health and psychosocial support directory is yet another step in the ministry's commitment to partner with mental health allies to provide improved access to mental health and wellness information and services. There's a lot to be done, but it is encouraging to know that we are making rapid strides. Dr. Tedros, Director General of the WHO, has said, good mental health is absolutely fundamental to overall health and well-being. At the Ministry of Health, we subscribe to this statement. Dr. Othello touched on mental health and COVID-19. Like the rest of the world in the midst of this pandemic, it has negatively affected mental health of certain individuals in Trinidad and Tobago. According to a recent 2020 WHO survey, the COVID-19 pandemic accounted for either interrupting or stopping critical mental health services in approximately 93% of countries worldwide. That is a frightening statistic. It has either interrupted or stopped. What is good about Trinidad and Tobago? Yes, it has interrupted, but thankfully it has not stopped the provision of mental health services. Why can I say that? Because in recognizing that the delivery of mental health services could not continue in the way it was continuing, I took a note to Cabinet, I believe in 2018, to put into motion something which has been talked about in Trinidad and Tobago since the 1960s. That is the decentralization of mental health. To move away from the old model of seeing St. Anne's as a sanatorium, of seeing St. Anne's as a place where people live up their lives, as seeing St. Anne's as a place where we warehouse people for 30 years, stripping people away of their dignity, and actually contributing to the stigma of mental health. Dr. Othello will tell you that even before today, recognizing the effect of COVID-19 on mental health, she was an integral part and presenter at our COVID-19 press conferences, talking to the population about mental health, the services available, where to access services. And it's a good thing that this government started that decentralization policy about over a year ago, 2 years ago. I shudder to think where the mental health of this country would have been if we had not started that decentralization policy. At the government level, we have long recognized there is no health without mental health. The Ministry of Health has a national mental health policy that recognizes the broad range of social problems linked to mental health and the direct and indirect cost to our citizens. In treating with this issue, the Ministry of Health and the Minister of Health advocated that mental health now be treated as a non-communicable disease and got that approval from the Inter-American Development Bank, so that a portion of that $55 million US loan, which we signed in 2017, I believe, to treat with the typical NCDs, diabetes, hypertension, high cholesterol, stroke, and all of this, and setting up the cancer registry, the NCD registry. Now mental health has a place around the table on equal footing with diabetes and hypertension, as far as policy interventions are concerned. And the same way we are setting up the cancer registry, this registry will go a very long way. Governance and leadership is one of the 5 action areas of the National Mental Health Policy. It will influence items such as service delivery, mental health promotion and prevention, human resources and training, research and information systems. It is to be noted that a critical factor in the successful implementation of the decentralization of mental health services is the astute leadership of a qualified director, a post which Cabinet supported me in creating. And I'm pleased to say, we have found a daughter of the soil to lead this charge in the person of Dr. Hazel Othello. The decentralization policy is a reflection of international best practice. As I said, it was a dream being spoken about since the 1960s. And here we are 60 years later, and we could talk about it, laying down its roots. And I hope those roots deepen and get stronger. What are we going to be doing with this decentralization policy? We are going to be expanding our community-based mental health facilities and decreasing the population at St. Anne's, which has already begun. So these individuals who have been screened and are clinically okay to be treated in their community within the bosom of support of the community and families, that has already begun, I am happy to report. We have started up 3 acute inpatient psychiatric wards and units, 2 extended care centers, 3 child and adolescent outpatient clinics, 27 adult outpatient clinics, and 3 mental health wellness centers. We have started up our mental health gap action programs, and we have plans to expand the availability of inpatient mental health services in the general hospitals now in place for Sangre Grande, Arima, Port of Spain, and Point Fortin. Just 2 weeks ago with Dr. Hazel Othello, I paid a detailed and long visit to Ward 1 of San Fernando General Hospital. And it is our intention, with the help of the board, to find a dedicated facility on the compound of San Fernando General Hospital to treat with those patients in need of mental health and wellness services. In addition, we have expanded our delivery in Aranjuez, Diego Martin, and San Fernando. My dear friends and colleagues, in conclusion, to improve mental health of individuals and society at large requires the promotion of mental well-being, the prevention as far as possible of mental disorders, the protection of human rights and the care of people affected by mental disorders. It is going to call for a total re-engineering of the way people look at mental health. Dr. Othello, you may remember a few years ago at the Hilton, at a PAHO conference, before you were appointed, I said, in dealing with the stigma of mental health, we never tell someone to snap out of diabetes. We never tell someone that it's all in your head when you have high cholesterol. But we always tell persons with mental health, snap out of it. You can't. We always tell people with mental health, you know, you bring this upon yourself. They don't. The same way a person cannot snap out of diabetes. And I remember saying this about 4 years ago. Dr. Othello, you were there. You can't snap out of mental health. You can't. And this is where the understanding, empathy, and more importantly, the sympathy and empathy of those suffering from mental health, they need us to support them. So in conclusion again, it is going to involve early intervention, like diabetes, like hypertension, like cancer. If we adopt that model of early intervention in mental health disorders, we can work wonders and not have mental health, as I said at the start of my presentation, to be seen as the ugly duckling of the health system. I want to assure all that you have my total commitment, as I have demonstrated empirically, that mental health is on the agenda, has been on the agenda of the Ministry of Health under the stewardship of Dr. Keith Rowley and his cabinet in supporting me. In closing again, I want to thank everyone for laboring in the vineyard under very difficult circumstances with mental health, and assure you of my continued support. I thank you, and I hope you have a wonderful conference.
Minister Deyalsingh, thank you very much. Your speech summarizes the fact that for effective action to be taken, it takes those who act on the political level, therefore make decisions for the country, and you have done that. Those who support them in the administration and development of those policies, both Dr. Wheeler and Dr. Othello have spoken to that. Now we come to the launch of the Directory of Services, and to that we turn to Ms. O'Brien, who's been very active in doing it. Ms. O'Brien, the floor is yours.
Thank you so much, Honorable Chair, Ms. Lucy Gabriel. Good morning, everyone. Good morning to the Honorable Terrance Deyalsingh, Minister of Health, Dr. Hazel Othello, Chairman of the MHPSS Technical Working Group and Director of Mental Health at the Ministry of Health, officials from PAHO, WHO, including Dr. Erica Wheeler, Dr. Taralene Malcolm, and Dr. Claudio Cayetano. Ms. Wendy Jeremie, President of TTAP, and the amazing team of at the Mental Health Unit of the Ministry of Health, whom we have had the amazing privilege of working with closely, along with my fellow MHPSS Technical Working Group members. It has been a true privilege working on this project and being the development lead for the network on this project. So I'm going to share my screen now. Okay. All right. So let's see. Oh, there we go. So I represent an organization called Mindwise Project. Mindwise is a nonprofit organization whose goals include fostering a digital ecosystem of knowledge sharing and improving access to mental health services, education, and resources. We have developed this directory to serve the mental health and psychosocial support network of Trinidad and Tobago, of whose technical working group we are a member. The technical working group of the MHPSS network coordinates and leads the resources available in this directory. And on a personal note, I really wanted to speak to the power of this directory within the community behind it. There have been quite a number of directory projects in the region and internationally, and I think what the MHPSS network really does provide is a powerful community. We have had a great experience connecting with leading professionals and organizations who have been taking charge of major impact zones. And within that, that is how the knowledge represented in the directory is very powerful. We want to offer special thanks to the Ministry of Health, PAHO, WHO, Trinidad and Tobago, and the MHPSS Technical Working Group members who all have offered their time and energy in working with us as the developers to make sure that the information is accurate, as well as to help us gather listings within their organizations of the resources that they have. I also want to acknowledge my development team. I myself am the lead. I am also an ambassador to Google Women Tech Makers, as well as the director of digital arm of Mindwise. Alyssa Khan is my co-lead. She is currently the Behavioral Health Policy Fellow at the Children's Law Center in Washington, D.C. Elise Marcella, who's my co-director. She's also a director of research at Mindwise Project. Michael Latman, who's been a volunteer developer, who's been supporting us from abroad, as well as a Richard Dalal, who's been supporting us with security, making sure that our directory is safe from the UK. So the first thing I'm going to do is just go through each one of the major features for all who are present of this directory. And the first thing that I really wanted to, let me just, let's share here, that I really wanted to get into was the helplines page. So this is what you will see when you come to the directory domain, which is findcaretT.com. And the first feature that I felt was really powerful for us to start with is the helplines page. This was actually an idea from within the network from a member from the Ministry of Health. And I thought it was such a fantastic idea. We implemented it in less than a day. Basically what we're going to be doing, I'm sure you see multiple images and multiple shares of different hotline listings and emergency numbers from different networks. We are going to curate and continue to curate, as we have done, a single listing of all the emergency mental health crisis and emergency numbers that are in the country and are currently being offered by organizations who have strong validation and support from the Ministry of Health. Okay, the second thing that I wanted us to go into is that the website does have a Spanish translation capability. This is of course important for our migrant population. Who have been identified as a major at-risk community. So we thought it was very important to have a very simple language switcher. As you see how easy it is, it translates immediately. It's one of the best language switchers available to web developers. And it's very easy for us to switch back, and it's always hovering should anyone need it right away. The next important feature of this directory is the search and filter function. Now, the search and filter function is really something that based on our experience and based on my own personal experience as a person who struggles with PTSD, very often we find a lot of listings that have quite a lot of very powerful information, very important information, but the ability to search for things based on categories and target populations seem to be a very important part of finding the right information. So what all of our amazing MHPSS Technical Working Group members participated in was an information, a data collection exercise where we not only gathered their information, but we also gathered their the types of services that they offer alongside the target populations that they serve. Yeah. So what this means is that a person can search and filter based on what they need. So if a person is looking for suicide prevention resources, immediately you'll see that all of the organizations that have been tagged that offer suicide prevention resources immediately pop up. Now, we also have a more live search, which in case someone may be a little bit overwhelmed with our live AJAX search, is a little bit more, it's more of a smart search, especially for people who are mobile. Based on our analysis of the website so far, 70% of the people accessing this resource are accessing it via mobile phones. So it was very important to us for us to have a search that was friendly to mobile. This search, which you're looking at right now, is a little bit more focused, and it gives a full detailed listing of all of the categories of services, as well as all of the target population tags. So a person can just look through it and read through all of the types of services per organization, but also they could just search as well. Using the word search inside of this table, you immediately see that all of the organizations that offer suicide-related services have been shortlisted. And without even going through any of them, we have a very basic summary. We have additional directory listing categories and tags, and it really does help someone figure out exactly what it is they're looking for. Okay. Now, the feedback form loop is an important part of how we are going to be keeping ourselves accountable for the information that we have on this website. The feedback form is available in 2 different places. It's available both on the homepage, where we ask people if you have important feedback. We want to make sure that the resources and listings are helpful and accurate. And what that means is, besides our own verification process, which has been very detailed and will continue to happen routinely over every month. Every month we are going to verify the information that's on the website. However, we wanted to make sure that in the event we miss something, or in the event that a service has changed suddenly and it was not reported to the MHPSS Technical Working Group, that the public has the ability to send us feedback so that we can look into the issue and, of course, confirm whether the details continue to be accurate or if it needs to be changed. This is an important part of any directory, is the ability for people to give feedback and to give input on what they are experiencing using this resource. So that was also something that we thought was very important. Now, going back to the homepage, I really wanted to just highlight a few specific areas that I thought were very important. So we've already gone through the search services and resources page. We have a featured resources section, which involves resources that are related, that have been sent to us, or that are related strongly to disaster mitigation. One of which has been the OECS PAHO telehealth resource. Another one is PAHO Virtual Campus, which is free training for both professionals and, I suppose, caretakers, people who might be very interested in learning more about some of the areas that they're struggling with. And the Stronger Together Psychological First Aid campaign, which of course is a very powerful, campaign resource for those of us who are advocates, as well as community leaders, that we can use those materials. Now, if you go to the top menu, you'll see that we have a navigation menu that has several sections. So I want to go over to the Regional Health Authorities page. In the Regional Health Authorities page, we have taken time as the MHPSS Technical Working Group to digitize all of the information that has been presented both on social media as social shares. So all of the things that were sent to us as images, we have converted into very editable, very filterable tables that, of course, definitely increase the shareability of the information, as well as the continuation of making sure this information is up to date in a one source sort of way. So similarly, with the regional health authorities, they have all been converted to searchable and filterable tables, which means that if someone is looking for rehab services, for example, they can just type it into any table, and the one organization or the one or two organizations that will be offering this service automatically get shortlisted. This ability to search and filter is very important for people in crisis. So we made sure to implement it into all of the lists that you see on this website. Now, PAHO WHO was very helpful in sending us their resources. I think they were one of the first to send us their list of resources. Each of these resources have been turned into similarly a searchable, filterable table. And it links to the resources which are hosted either on PAHO's network or on other networks that they recommend. Similarly, underneath each header menu item, so in this case, it's PAHO WHO, we have included other PAHO resources that are related to the emergency response. Now we have social services, which has been, those people who are related to those service providers who are related to social needs, social development. We do anticipate this list will continue to grow. We have had more than one submission from the public already. And once each submission is validated by the technical working group, then we will add to these tables. We do not intend to simply add just anybody and everybody to this directory. Each person who's added to the directory has been validated both by the Ministry of Health as well as the technical working group. Now I wanted to take just a minute because I know I don't have a lot of time. I told Anthony I would only be 8 minutes. I haven't been watching my time. So I wanted to go through quickly the coping materials section. Now this coping materials list was put together by the Ministry of Health. We will continue to build on it as they get put together. But underneath coping materials, we also have two sections that are very important to us here at Mindwise, as well as to the technical working group. One is a mobile apps and websites page. This mobile apps and websites page, a list of apps that are considered to be some of the top rated apps when it comes to mental health, and also apps that we ourselves can vouch for. So of course, we definitely wouldn't list any sort of mobile app that we haven't tested and that didn't have a very strong recommendation on via the mental health forums that we are all a part of, or some of us may be a part of on the internet. So this list we also anticipate will continue to grow. We've already been sent, we actually have one or two other resources that we've already been sent to add to this list. We also have a videos page, which is where when members of the MHPSS technical working group and in public the larger MHPSS network, as we continue to build this network, once someone works on the video, we will add it to this playlist so this playlist also will continue to grow. 3 other small sections I just wanted to touch on briefly, especially as some of you may want to share some of these listings. We have a very detailed gender-based violence page, which I do hope some of our partners and the larger MHPSS network will continue to grow. One of which is a series of organization listings, of which includes GROOTSTT, the Coalition Against Domestic Violence, Rape Crisis Hotline, Victim and Wellness Support Unit, etc. Underneath that, we have the gender-based violence units of the Trinidad and Tobago Police Service, and this was also a really great listing to have on this page. So similarly, we're going right back to a sort of one hub resource for all of these numbers and information. If you just need to send somebody right away, you can send them to the domain, which was actually a domain that was voted on and selected by the entire technical working group. So we're very excited to see how well the domain will perform in its shareability. Now we have the children and adolescents page, which we're also hoping to grow. If there are organizations that that offer specific information or resources or crisis resources for children and adolescents, please submit it to the Ministry of Health, or you can email it to us here at Mindwise, and then the technical working group will review it. We also don't expect to grow this list with resources that were sent to us by the Ministry of Education. However, that will be done over the next few weeks. And last but not least, we have the addiction support section. We've done some work looking for some online resources. There are lots of in-person resources that were being offered by treatment centers. This list was also curated by the Ministry of Health. Thank you very much to the mental health unit. You guys are amazing. But we've also added at the top 2 virtual Zoom Narcotics Anonymous meetings that we became aware of after verifying some of the information listed in these tables. So, and I think that's it. You know, we were very proud to work on this project. I think that it is our hope that organizations will submit. So you see here on the homepage, you can submit a mental health service or resource to the Ministry of Health and a technical working group. We've already received some responses. Actually, I wanted to give a small review for those who are present. Since we've launched the website, we had a soft launch of the website for those who may have needed it over the holiday season. We had 1,000 website visits in 20 days and 339 unique users, and most of these users returned. The demographics of the users have been quite split down the middle, gender-based, which is actually a great success that we've had, because normally you may expect to see more of a dominant gender, as most, but the fact that we have so many men visiting the website is actually very good, because they are, of course, a special group based on many societal factors that we've been reviewing, but also the fact that women can access is also great. The age groups as well has been dominantly people between the ages of 18 and 34. And because of, through my own advocacy, I know that that's actually a very high risk group for suicide. I think that's amazing that we've been getting those persons to show up and visit the website. So, you know, that's it. I think that I've had a lot of challenges since I've returned to Trinidad and Tobago in finding the right resources to get the help that you need. And I think what we've accomplished here as the MHPSS Technical Working Group has been very reassuring, both as a mental health advocate and activist, but also as a person who knows that these resources are needed. So Mindwise Project has been very proud to deliver this as part of the MHPSS Technical Working Group. We are committed, as well as the other technical working group members, to keeping this information accurate, as well as continuing to grow the information here on this resource. So thank you everyone for listening to my presentation. If anyone has any questions, you can put it in the chat. I will try to respond to it as best as I can. Thank you, everyone.
Thank you, Maria. It was enlightening. The amount of work you've done on this really shows. Mr. Deyalsingh said since the 1960s, they've been working on mental health. Those of us who work on this know how difficult it is to keep information current. By the time it's produced, it is out of date. So thank you very much for the work that you have done. Those who use it will deeply appreciate it and do not forget it.
Thank you, Lucy.
You're more than welcome. The statement for the declaration of the official launch comes from the president of the TNT Association of Psychologists, Wendy, Jeremie. Wendy, the floor is yours.
Thank you very much, Madam Chair. Minister of Health of Trinidad and Tobago, the Honorable Terrance Deyalsingh. PAHO WHO representative, Dr. Erica Wheeler. Director, Mental Health Unit, Ministry of Health of Trinidad and Tobago, and Chair, Mental Health Psychosocial Support Network, Dr. Hazel Othello. Specially invited guests, members of the Technical Working Group, ladies and gentlemen. When we look at the world and everything all around us. We marvel every day. This very world has been transformed by the COVID-19 pandemic, as a result of which we have had to adapt and make an unprecedented change to our lives. To this end, PAHO WHO, together with the Ministry of Health of Trinidad and Tobago and members of the Mental Health Psychosocial Support Network, came together to produce the Mental Health Psychosocial Support Directory of Services entitled GROOTSTT, of which we are justly proud. Today, it is my honor to declare this directory open to be utilized by all of our citizens as our future remains uncertain. May we continue on to work together to ensure the mental health stability and psychosocial support of the citizens of our beloved country, which must be given priority. Find us at findcareTT.com. Thank you very much for this opportunity. Over to you, Madam Chair.
Thank you, Wendy. We have stakeholder greetings in order. Dr. Peter Weller, the Caribbean Alliance of National Psychologists. The floor is yours.
Good morning, all. Thank you, Madam Chair, and of course, as per protocol.
Dr. Weller, we're hearing you very faintly.
Are you hearing me now?
A little better.
Okay, I'm not sure what it is, but I'll try to speak a little more loudly. Honorable Minister Terrance Deyalsingh, our representative from PAHO World Health Organization, Dr. Erica Wheeler, our eminent chair and director, Dr. Othello, and of course, the team from the technical working group, the partners, including represented, I believe, today, the Red Cross, Childline, Trinidad and Tobago Association of Psychology, and the Franciscan Institute. I greet you all on behalf of the Caribbean Alliance of National Psychological Associations. Our president, Dr. Guillermo Bernal, and our incoming president, our Trinidadian colleague, Dr. Khadija Khan, as well as my co-chair of the Disaster Mental Health Committee, Dr. Alisa Alves. We are very pleased to be able to bring greetings because we are truly excited about this initiative. I think that as an alliance of national psychological associations, we are a regional network of national organizations and groupings of psychologists. And as a result, we are able to speak to and speak for the range of psychologists operating across the Caribbean. We represent 14 countries, and in our initiatives, we particularly are concerned about providing collaboration, ensuring quality of service, and in particular, facilitating access to services from the residents of the Caribbean. We therefore are very excited about the work that has been done by the Technical Working Group, the Mental Health and Psychosocial Support Technical Working Group here in Trinidad in collaboration with Mindwise and all the various partners and stakeholders who have contributed. Clearly, in this era of COVID, we are particularly challenged to provide the services that are going to be needed by all our constituents. We feel, therefore, that this initiative, this platform, is probably one of the most exciting endeavors in recent memory that is likely to provide not only an access to resources, but a facility to provide opportunities for development of new resources to meet the gaps, as well as increased partnerships and collaboration among those who are in the community of both interest, purpose, and practice. We therefore commend the work here in Trinidad, and we certainly hope that our colleagues here, including our colleagues from PAHO, Dr. Kayetan and Dr. Malcolm, who we've worked closely with, will help to facilitate a duplication and a replication, in this case, in a positive sense, of this platform and of this model of facilitating access to directives of services. So once again, I bring greetings, and in particular, I bring congratulations to all involved in this endeavor. And you can be sure that CANPO, the Caribbean Association of National Psychological Associations, will, as an alliance, support this initiative as much as possible in the region. Thank you, and over to you, Madam Chair.
Thank you, Dr. Weller. We move to Akeisha Benjamin, Program Officer of the T&T Red Cross Society. You have the floor.
Thank you very much, Madam Chair, and good morning to everyone. And thank you so much for all those who went before me, who observed all the protocols, because I only have 2 minutes. And I have been warned the entire week by Anthony and Madam Chair that I only have 2 minutes.
2 minutes.
Because I have been known for talking a lot, more than 2 minutes. So a pleasant good morning to all again. I am very misty-eyed as this has been a long process and a long journey. So I'd like to say congratulations to everyone who's been part of the process. And thank you to the Honorable Minister Deyalsingh for acknowledging all the hard work that Dr. Othello and staff has been doing on their end. It is truly an honor to be a part of this launch, as also a member of the technical working group this morning, the launching of the Directory of Services. Because what this directory has shown us is that there needs to be a lot more dialogue around mental health issues, psychological issues. And a lot of these conversations need to take place in the sunlight and have more unashamed conversation around it and surrounding it. Persons that are struggling with mental health need to recognize that they do not need to struggle in silence anymore, that there is a full network out there who is willing and able to support them in anything that they do. We do recognize that 2020 was indeed an unprecedented year that required each and every one of us to adapt to new experiences, new normals, and an uncalculated amount of hand washing and hand sanitizing. We gave up hugs and kisses for face masks and elbow bumps. We partaked, or we were not allowed to partake, I should say, in festivals and festivities. Zoom, online meetings, mute your mics were words that were added to our dictionaries at some point in time, and it became part of our new normals. We were asked to social distance, which also increased some of our social issues. And of course, it became extremely overwhelming to some of us in our coping mechanisms. Some of us completed the race of 2020 with vigor, and some of us was left behind. But as a people and a nation that I'm extremely proud of, we rose to the occasion. We chose to isolate, separate, and of course, be responsible. And the launching of this directory only goes to show you that the work isn't condemned, as the Honorable Minister said, but this is just the beginning of many. What this directory, and we are aiming and hoping to do, it would allow persons to have more options and more access to mental health and mental health organization and facilities that will help you along your mental journey. You have the power to choose your course, but you do not, again, have to do it alone. Because when you deny your stories, it defines you. We want to help you to rewrite your own story and rewrite your own narrative. And as I come to the end of my 2 minutes, I would like to again remind persons to isolate, separate, be responsible, and feel free to use the network. Thank you, God bless, and good luck.
Thank you, Ms. Benjamin. To Mary Moonan, Coordinator of Lifeline. You have 2 minutes. Floor is
Madam
yours.
Chair, I am the coordinator of Childline, Lifeline is yours. Good afternoon,
A
everyone.
psychological slip.
All protocols are observed. It is a great honor for me to offer greetings on behalf of Childline and also all the members of the MHPSS, in particular those that provide essential helpline services. I know as professionals, most of you have been addressing members of the MHPSS, but I would like to switch and address members of the public because for far too long, mental health issues have been associated with madness, with people who don't know what they are about. And I think it is time that we recognize that there can be no health without mental health. Mental health is just as essential and important as physical health. We need to take care of both our physical health as well as our mental health. And therefore, the stigma and discrimination that have been associated unfairly with mental health issues need to be removed once and for all. Sadly, we have not made much progress as members of the public with regard to public health. The professionals have advocated, progressive treatment, etc. But we are still mired in the culture that mental health is madness and that anyone who seeks help for their mental issues are crazy. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stresses, especially in the COVID pandemic, how we relate to others, and make choices. Mental health is important at every stage of life, from childhood to adolescence and throughout adulthood. I therefore appeal to members of the public to please promote and support mental health. Use this crisis support directory, which has been so well put together by Maria O'Brien of Mindwise. Please use it as an excellent source to help those who are in need of help. And for those who may have mental health issues, please consult this directory as you will find that there are lots of up-to-date and accurate information that can help you. So on behalf of all members of the MHPSS, I thank you for listening and I hope you will continue and promote mental health. Thank you.
Mary, I apologize. It was a mental scene coordinator. That's what does it. I apologize. We go to Stacey Ogis, who is the Trinidad and Tobago Association of Psychologists, and she's from Tobago. The Tobago arm of it, Dr. Ogis, the floor is yours.
Pleasant afternoon, everyone. All protocols observed. It is my pleasure this afternoon to represent Trinidad and Tobago Association of Psychologists. We're here to bring greetings and welcome the initiative Find Care TT through the Ministry of Health and PAHO. We know that mental health issues are prevalent, and since COVID-19, mental health issues continue to rise. We are seeing more persons affected on a daily basis, including children with mental health problems. The members of TAP are committed we are ready to respond to all the needs that the population may have when they access this directory. Mental health issues are real, and this is a start to reducing the stigma and changing the mindset of the population of Trinidad and Tobago. Trinidad and Tobago Association of Psychologists, we are here to say welcome to the Directory of Mental Health as we service the country of Trinidad and Tobago. And I will end with a recent quote by the Honorable Minister Terrance Deyalsingh. Mental health is not the ugly duckling of the healthcare system. So it's about time we start to reduce the stigma and allow persons to access the services so that each and every one of our mental health will be on par and will be able to take the health care of Trinidad and Tobago forward. So thank you everyone and welcome to the directory.
Thank you, Dr. Ogis. Last but not least, Dr. Karen Moore from the Franciscan Institute Trauma Team. Dr. Moore, the floor is yours.
Thank you, Lucy. Good afternoon, everyone. All protocols observed, and I'm very honored to bring greetings to this group, members of the technical working group and the public and our distinguished guests and co-workers from the Franciscan Institute Trauma Team. We are a small group of mental health professionals from around the Caribbean whose mandate is to provide voluntary mental health services following natural and man-made disasters in the region. And doing that work, we are very, very aware of how important it is in a disaster situation for people to be able to quickly and easily get access to services and to know what services are available. And this tool that Mindwise has developed does exactly that. From the technical working group, something has been produced that is permanent, that is sustainable, that is going to be dynamic in that it is going to be constantly updated so that people are getting access to current information. I think it is amazing that the situation of COVID-19 has been transformed with the use of technology and the need for everything to be distanced and online. Those elements have been taken and transformed into this very, very powerful resource that we really hope will be a model throughout the region, that it is something that will serve as a model for a regional directory as well as for national directories. So we really, as the Franciscan Institute Trauma team, we really are very, very grateful to have this very powerful new resource to add to the tools that we work with in mental health. The entire technical working group did participate in sharing their information and adding it to the database. But again, it's been said before, but it can't be said too often. Mindwise did a really amazing job in producing this beautiful streamlined tool that I think we're all in awe of. And it ensures that our work as a technical working group is going to continue beyond this crisis, beyond this pandemic, and this is going to have a lasting effect on the lives of many people in Trinidad and Tobago. So we really look forward to continued use of this and continued work with the technical working group. Thank you.
Thank you, Dr. Moore. We come to the lady in chief of giving the vote of thanks, Dolores Robinson, who's Executive Director of the grassroots organizations operating in Sisterhood Groups, co-chair of the MHPSS Technical Working Group. Dolores, the floor is yours.
Good afternoon, everyone. Sorry, I'm not sure what is happening with my video, but I'm hoping that everyone is hearing me loud and clear. It is indeed a pleasure to be a part of this launch. Find Care TT is the baby and brainchild of the MPHSS Technical Working Group. My task this afternoon is to say thank you to our presenters. And I will start with Dr. Erica Wheeler of PAHO, who, for her words of encouragement and the overview of what is happening in the mental health regionally. Then we go to what I call the captain of our ship, Dr. Othello. And she did a very, very comprehensive overview of the work that is being done. Well, we started in May, so the work that is being done by the Technical Working Group and the MPHSS team. We would also like to thank Minister Terrance Deyalsingh for his words of encouragement as we forge along in what we are doing. And in particular, the area when he mentioned that, while he calls it an ugly duckling, I would call it taboo area of mental health. I remember in 2017, I think it is, when I had a meeting with him, I met him at a political meeting, and I told him what, groups, and he said to me, we in the ministry, we are doing something for community mental health, to make it a community. Dr. Deyalsingh, we are grateful for what you have been doing, and in particular, the words that you shared with us, and I quote, "You cannot manage what you cannot measure." And as managers, we all should, take heed from that. Also, he did mention the areas that the government has been working in. We are also very, very happy to know that the Ministry of Health and the government, mental health is on the government's agenda. Then we go to the launch of Final Care TT. Maria, we would like to thank you very, very much, you and your development team, very, very much for the hard work, the dedication to seeing this project through to where we are today. The Directory of Service that we can all, and I'm sure all the members of the technical working group and all, well, at one stage we had 70 something participants, we're down to 64. We are proud of this product. We would also like to thank Wendy Jeremie for her declaration of the launch of the Find Care T&T. Greetings came from our members of our technical working group, and we are very, very happy to know that our technical working group members are part of this launch. And we will start with Dr. Peter Weller, who I would say bring us regional representation. Thank you very much for your words of encouragement and enlightenment, Dr. Weller. Then we go to, from an NGO perspective, the Red Cross, Trinidad and Tobago Red Cross Services. Akeisha, thanks for your assurance that we are not alone in this fight. Also, we would like to thank Miss Mary Moonan from the Childline. She raised some areas that we should not, both Mary Moonan and Dr. Ogis raised some areas where we need to look at lifting the veils as it relates to mental health issues. We need to destigmatize mental health issues. And both, as I said, both Dr. Ogis and Miss Mary Munan spoke to that issue. And finally, Dr. Karen Moore, we thank you very, very much, Dr. Moore, especially when you look at mental health services during disaster, and I would say disaster and pandemic. Members, I thank you very, very much for your time, for your service. We started in May. We don't know how far we will go, but thank you very, very much to every member of the technical working group of the MHPSS. Over to you, co-chair Lucy.
Ladies and gentlemen, we have been on for an hour and a half and we have not really noticed. It's got better and better and better. Once again, to everybody who's attended, all protocols observed, but I do not think that anybody would mind if I said greatest congratulations goes to Maria O'Brien. Well done. So, good afternoon. We look forward to more goodies